Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll discuss a very infrequently used remedy which is very important in a practice because it has a lot of symptoms which are very unique to its. The remedy which I'm talking about is Badiyaga. Badiyaga. It's a very interesting remedy and I have found clinically very interesting symptoms in relation to Badiyaga in respiratory tract symptoms. Remember that whenever the respiration gets arrested on going to sleep, of course there are other remedies also which I will tell you in comparative mater medica, but whenever the respiration is arrested on going to sleep, do think about Badiyaga. We have very interesting remedies in comparison with that. That is sulfur is there, spongia is there, carbovish is there, Sambucus nigra is there, but Badiyaga is also there. The most important symptom of Badiyaga and respiration is that respiration is difficult when lying. This is lying aggravation, especially on right side. So whenever a patient comes complain that I have difficulty in respiration, मुझे सांस लेने में तकलीफ होती है जब भी मैं लेटता हूँ, ask him the next question on which side it is more. And if he is Badiyaga, I'll tell you that on the right side the respiration is more difficult when I lie down. With this again do compare Badiyaga with sulfur, spongia, and one of the very interesting remedies, again a rare remedy is there, that is squilla. But see how sulfur and spongia comes very close to Badiyaga in respiratory tract disorders, and that's why we fail to appreciate the symptoms and prescribe Badiyaga. Next symptom again, the respiration, in Badiyaga the breath is hot. Whenever the patient wakes up in the morning and says that I feel my breath is hot, the respiration, the breathing is hot, again this is again a very important entry point in Badiyaga. Whenever you're treating some disease condition and you have some symptom which are very unique and peculiar, and this is a peculiar symptom of Badiyaga, that the breath is hot when waking up in the morning, again do compare this symptom with one of the very important remedy, that is sulfur, and one more remedy, that is Sambucus nigra. Sometimes we don't understand what to prescribe when the cough is dry, the patient wakes up in the night, turns blue and all. So this is sometimes a very interesting symptom to understand and prescribe the remedy. Again, when it is said that in respiration, it is said that the respiration is impeded, obstructed while lying down, aggravation. But do remember, especially on the right side, lying down also you can take for Badiyaga. But if you say lying down aggravation, then you have other remedies. Sulfur is there, Sambucus is there, other remedies also. Now, sneezing, which cough which ends in sneezing. I have told you in my YouTube before also. This is a very peculiar symptom. The patient comes and tells you I cough, and once I sneeze, the cough stops. Now, this is again a very unique symptom of Badiyaga, and of course, do think about sulfur also. Do think about belladonna, Sambucus, squilla, and see how sulfur is so close to the respiratory symptoms of Badiyaga. That is, we have to understand comparative mater medica. I remember a patient, he came and told me that I feel as if मेरे गले में ऐसा लगता है कि शक्कर, सब शक्कर रहती ना, शक्कर ऐसी शक्कर डिजोल्व हो रही है अंदर, ऐसी शक्कर डिजोल्व हो रही है, शक्कर का समझ लगता है. And when I looked at the symptoms of Badiyaga, this is a very unique and peculiar symptom to Badiyaga only. That is cough, sugar dissolving in larynx. There is sensation as if particles of sugar in the larynx. The patient feels cough with feels sensation as if there is a particles of sugar in the larynx. And of course, this the patient will describe this symptom very precisely, because sugar, everybody has seen it, he can understand what is the meaning of sugar, and that's why this sensation the patient will describe very clearly. So understand this remedy. The patient says this sensation as if particles of sugar there when he coughs. That is very important, my dear friends. And the modalities, again, it is very important to understand. Lot of symptoms of cough are there, lot of symptoms of respiration are there, but how it is better. So in Badiyaga, remember, cough and the warmth ameliorates. Of course, you have remedies like spongia is there, belladonna is there, Equinata is also there, but Badiyaga is a very important remedy where the cough is ameliorated by warmth. And some few symptoms, one or two symptoms of expectoration of Badiyaga, that is very important. In Badiyaga, the expectoration flies forcibly from the mouth. As if when the patient comes, it comes out from the mouth. That is the expectoration of Badiyaga. Do compare again this symptom with one of the very important remedies of cough, that is spongia and belladonna also. And again, I would like to tell you the comparative remedy of Badiyaga, sulfur, spongia, belladonna, sambucus, they are so very close. That's why we sometimes don't prescribe Badiyaga and prescribe the polycrest remedy. One more symptom, that the expectoration flies out from the mouth and nostrils also. Now that is again a very, very unique and peculiar symptom of Badiyaga, from the nostrils also. So my dear friends, this is the clinical symptom which I have seen in my day-to-day practice, and I have prescribed Badiyaga on these symptoms and I have got very good results. As you all know that I will always share some clinical experience of my practice so that you also can get good results in your practice. I hope you like this video, and if you like this video, do share and subscribe. Thank you.